Hey friend, and welcome back to LW Pharmacy Technician School channel. This is your new content for this week. This is part 7. So if you've been following and you've been watching, you know we've been doing a top 200 drug series, and now we're on part 7, okay? If you're new to the channel, make sure that you subscribe, ring the bell for notifications so you can stay up to date with the content that we're putting out every week. Shout out to all my friends on TikTok, all my friends on Instagram, all of my friends who have been watching and following us for the past few years. I appreciate you. I'm so glad that y'all are passing. Shout out to Keely, who just passed her test. She reached out to me on LinkedIn. Y'all keep doing what you're doing. Make sure that you like, share, and subscribe to this channel, because you liking and subscribing to the channel helps to get the information into the algorithm so we can help more people succeed and become certified, and so they'll know that we exist. Okay. All right, friend, make sure you got your paper and your pen, because we jumping in and we're starting right now. So the first thing we're going to talk about today is brand name. Brand name is like the household name, right? Brand name is like the name that everybody knows you by, right? But then the generic name is like a nickname, right? So your name may be Tiffany, but everybody calls you Tiff. Well, your brand name is Tiffany and your generic name is Tiff. That's just an example, okay? So it says, what is the brand name of amoxicillin? And it goes into talking about the different antibiotic drugs that are here. Now, what I want you to remember is that amoxicillin is an antibiotic, and the prefix or the suffix "cillin" is listed at the end, and that lets you know that any drug that ends in "cillin" is going to be an antibiotic, and it is used to treat infections. Okay. Now, the brand name for amoxicillin clavate is going to be Augmentin. Augmentin, write that down. And all of these that are listed in the multiple choice, these are all antibiotics, and they're all used to treat infections. And the Augmentin is going to treat a sinus infection, okay? And it has 14 tablets, right? Typically, when someone takes an antibiotic, they normally take it for 14 days, sometimes 7 to 10 days. It's very, very rare that you will see someone on an antibiotic for months at a time, okay? And so, but for this one here, the answer is Augmentin, okay, friend? Make sure you're writing that down. Cillin, anything that ends in cillin is going to be an antibiotic. The next one is indication of medications. It says, which of the following medications is used to treat a bacterial infection? So we're still talking about antibiotics, because we're talking about an infection, right? It says, which of the following is used to treat which of the following is used to treat bacterial infections? Okay. So remember last week or in one of our videos, we talked about anytime something ends in VIR, it is normally used to treat a virus. Now, a virus and an infection is kind of different, because if someone has a virus, then it's contagious. If someone has an infection, it's normally contained within wherever it is, right? So, for example, someone walks around with a yeast infection. Well, if they sit next to someone else, that doesn't mean they're going to get the yeast infection. But you remember when the COVID virus was out, they would be like, if you were exposed to somebody with the virus, you needed to quarantine. So remember that virus and infections are two different things, which means that letter A could not be our answer, because it ends in VIR, which means that it is used to treat a virus, okay? Because the word virus starts with VIR. Baby, look, dropping them gems. That's why I told you, you better be writing this down. You better be writing. Too good. It's too good. It's way too good. So when we think about the indication of medication here, we're talking about K-Flex, and the antibiotic that we're looking at is letter B. Letter B is going to be the antibiotic that we're looking at for this particular slide. And it can be used to treat ear infections, tonsillitis, UTI, skin infections. All of them are listed here that it can be used to treat. friend, you don't have to remember all of this information here. I just let you know, this is what it's used to treat, but that's not everything that you need to remember. One of the things I do want you to know is that K-Flex is the brand name to cephalexin, okay? Now, if you notice the LEX here and then the LEX there, there's the correlation. There's the correlation right there, okay? You got LEX and cephalexin, and you got LEX and K-Flex. That lets you know that these people are kin to each other in some kind of way. Because normally, when you're kin to someone, you may have the same last name, right? So I just want you to pay attention to that. Write that down. The brand name of cephalexin is K-Flex right here. And K-Flex is a what? An antibiotic. Baby, not you learning 3, 4, 5, 6, 7, 8 things on this one slide. Okay, that's what smarter, not harder. Come on, teamwork. The next one, we're talking about drug class. Now, drug class is going to be on your board exam. You need to know this. Which of the following agent is an expectorant? Which of the following agent is an expectorant? The key word here is expect. When someone takes an expectorant, that means that they are expecting mucus, right? An expectorant is like mucinex, is basically what it is. And what that does is it breaks down that mucus. Y'all see that little mucus bug? It breaks down this little mucus slime thing. You be sitting on that commercial where that little thing be following these people around, all around work, be following them around all of their daily lives, talking about you can't get away from me and all of that. That's that little mucus bug, right? So when someone takes an expectorant, they can expect mucus to come up because now they are getting the medication they need in order to cough the mucus up, okay? When we think about an expectorant, we're going to think about guanfacine, letter A, guanfacine. And what are we expecting when they take guanfacine? We are expecting mucus to come up. What is guanfacine? An expectorant. Don't play with it, okay? So some of y'all have asked me about the 15-week online pharmacy technician training course that we have at LW. I wanted to drop some gems down on this slide for you. These are the textbooks that we use over here. And these textbooks can be found on Amazon. I'm dropping the link in the video description. If you are interested in enrolling, our class starts August 28th, which is in a few weeks. We still have some spots available. Each week you will complete a module. All assignments are due by Saturday at 11:59 p.m. Central Standard Time. Our course is PTCB recognized. So that is one of the things that is a requirement in order for you to be eligible to take the exam. If you have not completed a PTCB recognized program, you should have 500 hours in the pharmacy. If you don't have either one of them, you need to be enrolling in our 15-week class so you can have the eligible information in order to take the board exam. If you take the board exam without these eligible documents, you will not be given the certificate. I repeat, if you take the exam and you pass, but you are not eligible, meaning you didn't complete the 500 hours in the pharmacy, nor did you complete a pharmacy technician recognized program, you will not receive your certificate. Do not play yourself. You will waste your money and your time, okay? Also, our class includes one-on-one mentoring. We have when you enroll, you will be assigned a program mentor who will follow you throughout the entire 15-week program. They are there to support you, okay? They're there to help you to make sure that you're getting the most benefit from the course. This program is affordable, it is fast, and it is quick, okay? This is for individuals looking to make a change, looking to turn their lives around within the next 3 months, okay? Don't play with it. One of the things I want to bring to your attention is Kelly. This is Kelly. She completed our program back in 2017. I know that sounds like a long time ago. And when she completed the course, she got a job and began to work in pharmacy. And one year we were invited, a few years ago, we were invited to do a school recruiting event. And we hired her because why? We hire our graduates. Why? Because we believe in our graduates, because we know that you are being trained properly, that they are competent and confident, right? Competent and confident. And so we hired her to work the event. So definitely, if you are needing some extra help, if you're like, hey, I'm watching these videos, but it's still not clicking, I'm still struggling, I urge you to enroll into the next class. We start a new class every first Monday of the month. A new class begins. Which of the following medications could be used to treat anxiety? Remember, anxiety is something that messes with the nervous system. It is something that attacks the nervous system, right? And when we think about anxiety, we know that Schedule 4 drugs are commonly used to treat anxiety and depression. The brand name for the answer is Xanax. The answer is letter A, alprazolam. Alprazolam, okay? We know that if it's a Schedule 4, there is limited amount of refills. Limited amount of refills. How many refills can they get? 5 refills within a 6-month period. Write that down. All Schedule 4 drugs are limited to 5 refills within a 6-month period. The next one is indication of medications. We're talking about electrolytes, chloroquine. What does it provide to the body? Potassium. And where else can you get potassium? In these foods that are listed right here. All of these foods are packed with potassium, okay? Indication of medication. What condition is risdronate? I don't think I said that right. Indicated. What is it indicated for? I want you to know that this medication is used to treat osteoporosis. Osteoporosis. And when someone is taking Actonel, they're going to take it once a week, friend. That is it, once a week. You will notice there are only 4 tablets here because there are 4 weeks in the month. There are 4 tablets here because there are 4 weeks in the month. Remember, in pharmacy, we're expected to know that there are 24 hours in a day, 60 minutes in an hour, 7 days in a week, 4 weeks in a month, 365 days in a year, okay? As a pharmacy technician, you are responsible for that. If you are a nurse, you know you're responsible, okay? If you're in healthcare, you are required to know 60 minutes in an hour, 24 hours in a day, 7 days in a week, 4 weeks in a month. Typically, the month is 30 days, sometimes 28, sometimes 31. 365 days a year is what you are expected to know as a technician. 12 months in a year, 365 days in a year. These are household things that, baby, you ought to come with. You got to come with that, okay? You need to know when you're looking at these problems, you need to automatically be thinking, if they say that they're taking it every 4 hours, you need to know that that 4 is going to be divided by 24 because it's 24 hours in a day. And if they're taking it every 4 hours, how many times a day are they taking it? 6. I done told y'all. Don't tell me nothing about not liking math, because if you count money, if you use money, because we all use money, if you use money, you know how to do math, okay? If you use money, you know how to do math. If you're still watching this channel and you haven't subscribed, what you waiting for? And don't gatekeep the information, because you subscribing and liking the videos will allow the algorithm to share it with more people who are just like you. Okay. Generic names. We're talking about the active ingredients in Tylenol. Tylenol is also known as acetaminophen. Acetaminophen is also known as Tylenol. Tylenol is the brand. Acetaminophen is the generic. Okay. All of these can be used as pain medications. They all can be used for headaches and things like that. Okay. Generic name for Flomax. What is Flomax used to treat? Flomax is used to treat enlarged prostates. Write this down because Flomax is a very common drug. Flomax is used to treat enlarged prostates, and the generic name for Flomax is tamsulosin. Tamsulosin is the generic name for Flomax. Dietary supplements. Which of the following vitamins is a fat-soluble vitamin? Vitamin A is a fat-soluble vitamin, and vitamin A can also give eye support. Eye support for vitamin A, okay? All of these foods are also jam-packed with vitamin A. Drug-to-drug interactions. So if someone is taking a drug and they are prescribed a new drug, the pharmacist is doing something called a drug utilization review. Write this down. The drug utilization review or the drug utilization evaluation is conducted by the pharmacist. During that time, they are reviewing the patient's profile to see what the patient is taking and to ensure that there is no interactions, negative interactions with the new prescription they are being prescribed. The pharmacist is reviewing to see where the patient are and what the patient is taking. This is called OBRA 90, OBRA 90, OBRA 90. That is patient counsel. Who can counsel the patient? The pharmacist, not the technician. Okay? And if a patient is having a drug-to-drug interaction, the pharmacist is the one to reach out to the doctor to say, Doc, this medication interferes with the other medication this patient is taking. We're going to need to prescribe them something else. Because remember, sometimes patients are seeing multiple doctors, and every doctor does not know what every person is taking. One person, the OBGYN, may prescribe the birth control, and the primary care physician may prescribe the antibiotic. They may interact with each other negatively, okay? So when these patients are coming into the pharmacy, the pharmacist is the one that's going to counsel them on the medication, but before they counsel them, they are running the background to see, is anything going to interfere negatively? The correct answer for this question is letter D. It says, which of the medications should be avoided in patients taking ACE inhibitors due to its potassium-sparing effects? That's letter D, spirolactone. Spirolactone is used to increase potassium, to replace potassium. It is used for people with low potassium, okay? Letter D is our answer. If you are struggling, if these videos are not enough, if you took a course and you did not pass it, if you're new to pharmacy, if you've never done pharmacy before, if you know somebody who wants to be a technician, someone who wants to get on this tech money, send them to LW Pharmacy Technician School, friend, because this will keep everyone in line with what is required to pass the board exam, okay? I am so proud of you for showing up for yourself every week, every day, every opportunity you get, you show up for you. And it's important because if you don't show up for you, nobody else will. Make sure you create yourself a balance when you're studying. I tell y'all all the time, study 30 minutes at a time every 4 hours. If you study 30 minutes at a time every 4 hours, that will give you at least 2 hours of study time a day, okay? If you do 2 times 7, that's 14 hours a week. That's like a part-time job, okay? Please don't overwork your brain. Don't overdo it. Make sure that you are still enjoying life and that you are introducing pharmacy in a fresh, new, soft way, a gentle way, so your body and your brain won't reject it, because you don't want to look at this as a chore. You want to look at this as something that you get to do, something new that you get to do, okay? I am so proud of you. Please continue to create that balance. If you're taking your test this week, Make sure that you do all the ones you know first, flag the ones you don't know, come back and redo them, okay? Spend no more than 1 minute on one question. And if you don't know the answer in 1 minute, flag it. If you need to skip all of them and start from the end of the test from number 100 and work your way all the way to number 1, do it. Whatever it takes to increase your confidence and to increase your ability to pass. Okay, friend? I love you. I am so proud of you. Please keep pushing and don't stop. Do not stop moving forward, okay? I will see you next week. Bye.